I guess I have a question because I guess during late yesterday afternoon, early evening, I developed a gout in my right hand, or left hand, sorry. And during the night, I guess it sort of went into my left knee a bit. Is there, obviously not before the surgery, but after the surgery, is there some sort of medication I could take? I think the majority of the stuff that I've been taking in the past have been aspirin sort of based anti-inflammatories.
Yeah, this is a hard problem, and in the past we have turned people away to have them come back for their gout later, for their surgery later after their gout has resolved. One of the good features of the surgery, and good news about the surgery, is it tends to cure gout.
Okay.
On the other hand, the first weeks or months after surgery often stimulates the worst gouty episode you've ever had in your life, and usually the last. And so let me talk a little bit about that, and then we have to think about what to do for today. And I'll come to that after I do give you some background information. Gout, as you may know, and for those of you who don't know, is an elevation in what's called the uric acid. And uric acid is a metabolic product, chemical that's a breakdown product of protein metabolism. So, proteins are part of the body. They make up the structure of the skin and the muscle and much of the organ systems in the body. There's protein in the red blood cells, protein everywhere. Protein is the structure that makes us up. So protein is a foundational part of us. And the body has a way of getting rid of old protein. When it's done with it, it metabolizes it, chews it up, burns it up. And when it does that, it breaks it up first into peptides, which are little pieces of protein. And then peptides are broken up into amino acids, which are pieces of peptides. And then amino acids are broken up into uric acid. And then it's peed out. So if you want to get rid of a protein in your body, you send it to some protein enzymes, some proteases. The proteases chew up the protein into little pieces called peptides, and then the little pieces are broken up into amino acids, and the amino acids are chewed up into uric acid and thrown out. Now that's a good system and works great, but sometimes either there's a lot of protein breakdown or there's an inadequate excretion of uric acid such that uric acid goes up in the bloodstream. Now when uric acid goes up in the bloodstream, some of it starts to get into the joints. And so much of it can get into the joints that the uric acid can start to form crystals. And so there's an old science experiment that we used to do where you would heat up water and add sugar to the water, and keep dissolving it until no more sugar would dissolve. Then you let the water cool with a string hanging in the water, and it will crystallize sugar crystals, candy, around that string. Because as it cools, the sugar in water is super saturated, it crystallizes out of the water. And right now in your joints, uric acid is doing that. And it's a terrible disease. It's unbelievably painful, so we need to be very sympathetic. And then, as you pointed out, there are some standardized treatments. One is colchicine, and the other is indomethacin.
I think that's one they've been prescribing to me every can I've been trying.
Right. And then there's another drug called allopurinol, and allopurinol is part of the metabolic pathway that helps block the elevation in uric acid. So, you have been on allopurinol in the past?
No,
indomethacin. Because what we're about to do is metabolize protein and create uric acid like nobody's business. If you think about it, you have had a flare of your gout because there's some uric acid there. And the surgery changes everything. And there are lots of good things. And for gout long term, there's good news. But in the first weeks and months after surgery, remember we talked about the weight loss yesterday. Let's kind of go over that again. Everything that we do, we try and keep track of as best we can in a computer. So the numbers I'm going to give you are very accurate because we pester our patients and put everything in a computer. So we know, for example, over 9 years and 3,700 and some patients, the average weight on the day of surgery is right at 300 pounds. Some are above that, some are below that. And in the first month, as we talked about yesterday, the average weight loss is 30 pounds, of which we said most was water. But of the 30 pounds that's not water, the rest of the weight loss is not fat, but muscle. That is muscle protein. And as we talked about, when your body metabolizes protein, it ultimately creates uric acid. So if your gout is a flare-up of 2 or 3 now, in the coming several days, we're about to flood your body with a tidal wave of uric acid as we kind of starve you and prepare to get you through the recovery process. So the problem is not today's gout, but over the coming weeks that we would be required to give you lots of treatment for your gout, as the surgery itself causes a flood of uric acid to come into the bloodstream and into the joints. People who've been through it who don't have gout, we've had one other person who had gout on the day, and we usually cancel that surgery, because the surgery itself is going to cause such a flood of uric acid that although you're a stoic character and kind of putting up with the pain today, it's hard for you to envision what's in store with the flood of uric acid that's due in the next month. As your body lives off of your body, it's going to metabolize your own tissue to stay alive, because you're going to starve. Now, in a perfect world, your body would say, oh, no problem, I've got this stuff called fat. And what is fat supposed to be for? Yeah, it's supposed to be like in the bank, and you should go and withdraw that and burn fat. But if your body was good at that, you wouldn't be heavy in the first place. And unfortunately, sadly, and against our wishes, the person who's heavy is not good at burning fat. You know, what we'd like to do is, if I could, I'd like to speak directly to your body right now, right to your tummy, and say, burn fat. Don't burn that muscle, because we can't stand the muscle to be burned now, because it's going to pour uric acid in the bloodstream, and we don't want that. And we're saying, here, there's fat here, burn that. You've got all the calories you need. You don't need to burn any muscle. Unfortunately, we can't talk to the body like that. Your body, especially a heavy person's body, burns muscle. And for weeks and months afterwards, against our wishes, you lose muscle mass. That's why we recommend the whey protein and the creatine. So what we'll do when we finish is I'll call one of my colleagues who's an internist, and we'll discuss this, and then we'll chat a little bit. But we don't want you to hurt more than you're hurting. We don't want to give you tons of extra medicine because those medicines all have side effects on the lining of your stomach. So